Hello and welcome to the Caregiver Forum, a live stream event for caregivers to ask questions and get advice. I'm Mark Mariahana, founder of Otis Health, a free application that helps families and caregivers manage all their healthcare information. Our topic today is caring for senior adults, and I have three terrific guests with me. Nicole Goebel is the Associate Director for Community Initiatives at the Caregiver Action Network, a national nonprofit serving the over 90 million family caregivers in the U.S. who are caring for their loved ones, from a child with significant health challenges to a spouse with a disability or chronic condition to an older loved one with Alzheimer's. I'd like to also introduce Bailey Bischof. She's a clinical geriatric pharmacist working for a healthcare maintenance organization in San Francisco. She has been working as a pharmacist for over 14 years and volunteers in her spare time with a nonprofit organization in San Francisco that addresses older adult isolation. And finally, Ivana Kurian. She is a personal wellness expert serving private and corporate clients. She has been working in holistic health and stress management for over 20 years and holds a degree in psychology and is national board certified in therapeutic massage and body work. So how does somebody that's a first-time caregiver begin to even understand the medical needs of the person that they care for?
Well, I think the first step is to ask questions. A lot of first-time caregivers often feel uncomfortable journeying into the unknown, and often will feel uncomfortable asking questions. Ask questions, especially of your loved one's doctor, of their healthcare providers. Make sure that you're asking those questions so that you are armed with info as you continue to kind of go forward and are putting together kind of a care plan for your loved one.
Okay, very good, thank you. And so when you are asking those questions of the healthcare providers, is there something specifically you should start with when you're asking the questions?
It will really vary on the person. Every caregiving scenario is unique, and everyone's coming into caregiving with their own kind of set of questions, knowledge base. And so I think that, some of the first questions to ask are the basic ones. If you don't feel equipped of knowing kind of what your loved one's condition is, you are wanting to know very specific information, feel comfortable asking those questions. It's really going to vary from person to person.
Okay, very good. So Bailey, I have a couple initial questions for you. What is if we're caring for an older adult, especially, there may be quite a bit of medications prescribed to that individual, and it can be a bit daunting for somebody that's just taking over and that doesn't have a medical background. So what does a new caregiver need to understand about prescribed medication?
So one of the first things that caregivers should really understand is to really just lay out everything in front of them, but also ask their provider a comprehensive list of all the medications that they should be taking, and comparing whether or not the patient or the person that they're caregiving for has all the medications listed on that list. And if it's not matching up, dispose all medications that they're not supposed to be taking anymore. And just making sure that everything lines up. Another thing I really recommend is having a pill box as well, some sort of way to organize, to remind the person that they're caring for when to take these medications.
Oh, excellent. And whose responsibility is it really to make sure that the medications that the loved one or the person that's being cared for is taking is safe, especially in conjunction with other medications or therapeutic regimen?
So I always recommend my patients to have one designated person. Maybe it could be two designated persons as well, to be able to manage all the medications and do the front end communications with their physicians, to really know what they're supposed to be taking. And if the physicians aren't readily available, the thing about healthcare is we don't all work in silos. These days, they have a nurse case manager, they have a clinical pharmacist who could be able to, assist and relay that information to the caregivers as well too.
Okay, very good. Thank you, Bailey. Ivana, I'm going to ask you a question, and Actually, I'm going to get back to you in just a moment, Ivana. I'm going to go back to Nicole with one question here. So when you're taking care of somebody's, a senior person, obviously they're not in a bed that you're walking up to and taking care of them and walking away. They have, meaning that they have more in their life than the brief moment that you're interacting with them. So why, I've heard routines are important for senior adults, and why are routines important?
Well, routines are important for a lot of different reasons. And obviously this can be connected to a condition that your loved one has. Individuals with Alzheimer's and other types of dementia often rely on different forms of routine to feel kind of comfortable. But routines are also really great, I think, in terms of how you're working with other members of the care team. Oftentimes, there's not just one caregiver. There are other folks that may be helping out here and there. And so those routines can help make sure that nothing gets dropped, that, someone doesn't accidentally forget to go and pick up your loved one's meds, or that doctor's appointment isn't missed either.
Okay, very good, very good. And what is the caregiver's role in supporting that routine, or even establishing in the first place?
Well, oftentimes a caregiver is really the person that puts that routine in place. No one knows their loved one better than a caregiver. They see their loved one in all types of different settings, from their home to the doctor's office to the hospital to across all different settings. And so a caregiver is really important in terms of setting those routines and setting kind of a pace, and is really an advocate for their loved one, usually in how those routines take place.
Very good. Thank you, Nicole. And Ivana, how, being a caregiver can be overwhelming. And I would say that every caregiver will be overwhelmed at some point. It's unlikely that anybody is fully ready from the start to be a caregiver. And so what can first of all, how can a caregiver recognize when they're approaching a burnout?
Sure. There's often signs that come from how our body is doing that register before we might cognitively be aware that we're approaching the state of burnout. So looking for signs such as difficulty sleeping or changes in your sleeping pattern, emotional changes as well. So it could not just be mood swings, but maybe you're noticing that you're just really having a difficult time connecting with the people in your life that you normally enjoy connecting with. Or maybe you're really very easily irritated when at the little things, and you just aren't able to find that you're controlling your state of well-being in that way. Or perhaps you're even isolating yourself and you're just not wanting to see people, not even the people that you care about. So really watching for the emotional shifts. The other thing that our body often sends us when we're in a state of burnout or high stress, which is very similar, is our intestinal system is going to be upset. So that could go in either way, between how we're eating, how we're not eating, just maybe feeling knots in our stomach constantly. It also could show up in muscle aches as well. So just paying attention to all these subtle signs usually in our body and noticing if things are changing for us and we're reacting to things differently than we normally would in our body are often the first signs that perhaps we need to take a little time for ourselves.
Okay, thank you, Ivana. And back to the audience for a moment. As you have questions, please add them to the Q&A window at the bottom of your screen. You can also add any questions to the chat window and I'll catch them that way. So I'd like to go back to Nicole briefly here. So we talked about understanding somebody's medical needs, and most of the time when we're helping a a family member as they're getting older, they're having to transition from one medical practice to another, see specialists, and even move from one care facility to another. So what advice would you give a caregiver who needs to establish the coordination of care between the different medical groups?
Well, there's a lot of different approaches to this. One of the things that, from a general kind of perspective, is to keep everything together, what we call a patient file. So keeping all of your loved ones' medical records, that medication list, which I love that Bailey mentioned, that keeping a medication list of, not just the current medications, but former medications that your loved one had taken, so that, if those questions come up, you have that as record. Keeping everything kind of documented and in one place is really, really helpful in being able to then, as you're bringing in a specialist or any other kind of care provider, you're going to have all that information right there to answer questions and make it a little bit more seamless.
All right, very good. And Bailey, this question is for you. My father had a lot of medications assigned to him. I think at one point he had 10 different medications he was taking a day for different needs. And I always wanted to know, like, how often should we look at those medications and review them with a physician or somebody to see, are these still appropriate? So how often should a caregiver review the medications that are prescribed with a physician?
Yeah, that's there's no simple answer because it's not a one size fit all answer. It depends on how sick the patient or who you're caring for is. Some people have certain chronic conditions that might require even like monthly or weekly reviews of medications with their case manager, like chronic heart failure conditions. Certain diabetes states that are not within control should be assessed, I would say, at least quarterly.
Okay.
And but if if everything is stable, the person that you're caring for is doing pretty well, I would say at least every 6 months to touch base with the physician, to follow up on your at least yearly appointments, physical exams, and also to follow up any relevant labs as well, because all those things are interconnected and can change your medication regimens as well.
Okay, thank you, Bailey. And this brings me to another topic about the idea of having a backup caregiver. With Ivana, we talked a little bit about burnout, and in any case, it's not like a caregiver feels like they could take a day off, but at some point something happens and that caregiver may not be available. So what advice, Nicole, would you give a caregiver on planning for a backup?
I think it goes back to coordinating with that care team, be it other family members, even neighbors, friends, family friends, that you can bring in as part of that care team. Because you're exactly right. One of the things as caregivers is that we all feel that we should be able to do everything on our own, but we can't. And that's what leads to burnout and exhaustion and just really bad impacts on our own health. And then that makes it impossible for us to care for our loved ones. So having individuals that you can rely on to do any number of different things. It can, again, be as simple as, hey, I'm not able to go over and, make sure that my dad, if I'm caring for my dad, has taken their medication. Can you go over and see how they're doing? Because I have to work late tonight and I'm not going to be able to stop by. And, to going to doctor's appointments if you can't take that time off work. All of those things, I think it's really important to have a really good communication plan with that care team so that those types of arrangements can be made really easily and you can feel comfortable that, again, nothing is kind of getting dropped or that, your loved one isn't getting the care that they need.
Okay, thank you, Nicole. Ivana, what what can a person do to better manage the idea of a burnout, to actually help them prevent burnout or mitigate the impact of a burnout?
Yeah, definitely. The first thing for caregivers is it is a big emotional toll. It's not just the time commitment. So I really suggest that people consider seeking out regular support from a licensed mental health professional to really help you process everything, to give you that safe space to vent out whatever you're feeling, for example. Or some people might struggle with trying to cope on their own with some self-medication. And so also having a mental health professional that you're working with can also help you to process things so that you're not overly self-medicating and things and harming your health in that way. I also definitely suggest for people, and I've always told my clients, you have 100% permission to take breaks for yourself. And to build on what Nicole had just said, getting help in other ways. For example, it might be maybe this is the time that you actually hire someone to come and clean your house once a week. So it's one less thing that you have to do when you get home. Or perhaps you use one of the shipping services to do your grocery shopping. So it's one less thing that you have to do, and things of that nature. And in that way, perhaps you can build in just that little bit of time to take a hot bath at the end of the day or something else, because you've lightened your own load. So doing all of the creative things that you can. But I think the number one thing on top of giving yourself that permission is certainly seeking out some mental health professional to help you through this tough time.
Excuse me, I just realized I was muted. So I'm going to give you a brief, three of you, a brief story about my background of taking care of my father for a little bit when he needed care. What I found was made it easier for us and really helpful for my father was to establish a social routine for him. He liked playing cards. He wasn't really great at it, but he enjoyed doing it. So we found a senior center where they had card games going at least a couple times a week, and he made some friends. And it also gave me a break and my family a break from while he was there. Can you guys talk about like some ideas or advice you can give to caregivers to help them simultaneously get a break for themselves and provide social opportunities for the person they care for?
Yeah, I would love to jump off of what Ivana was talking about and support groups. Oftentimes, it can be really awkward to ask questions or share stories or ask for advice from anyone else than someone that has kind of been in your shoes, that kind of understands the journey that you're on. So in addition to seeking out kind of mental health supports, which absolutely, I think finding individuals that you feel that, be it a support group or something similar to that, finding people that understand kind of your scenario a little bit can make it a little bit comfortable and can often fill a social need. You guys, it can open up a place to kind of share and talk and build friendships. And so that's one, I think, avenue that can kind of meet multiple needs.
I'd also like to add as well, I work on a team with a lot of social workers, and I know that there's a lot of community resources in your community. And I have successfully referred a friend who was having burnout, caregiving for his dad. And I recommended him to check out a respite resource, which he used successfully. And they actually brought in a caregiver to give him a 2-week break from caring for his dad so he can recharge himself. So there are a lot of community resources out there, and I do recommend to work with your physician, and usually they'll have a social worker or some sort of community resource person who would be able to link you with the appropriate resources and support that you would need.
Okay. Thank you, Bailey. We're gonna, I don't have any more questions for you right now. Is there any advice or anything you'd like to discuss, mention to the group? to the audience?
I think the only thing that I would say, just kind of piggybacking on the topic that we've just touched on, is that it's okay to need a break. Again, a lot of caregivers feel like if they're feeling burnt out, if they're feeling like they need some time away, whether it's just time away to do their own errands or to do something that, is meaningful to them, that's okay too. That doesn't make you not a fantastic caregiver. That's part of it. So, it's always important. One of the things that we at Caregiver Action Network always stress is you have to take care of yourself. And that is not just from the physical kind of standpoint, but also mentally, emotionally, because as was earlier stated, caregiving takes a huge emotional toll as well. And it's really important that you're just kind of staying in tune with all of that.
Nicole, is there a crisis hotline that you know of when a caregiver is truly in crisis, where they just need help, they're in crisis at the moment?
Well, I think it depends. Obviously there's a lot of mental health resources that are crisis lines that if you do find yourself in a very specific situation, to reach out to. One resource that we have at Caregiver Action Network is called the Caregiver Help Desk. It's not a crisis line, but it is a resource, and it's exactly kind of how it sounds. It's kind of a customer support for family caregivers who can call and connect with someone and find answers. So if it is something, if you are a new caregiver and you have those very basic questions of, okay, well, what do I do now? We have folks that can kind of walk you through a process. It's all about listening first and figuring out exactly the resources that you need, the resources that are really going to be beneficial to you in that moment. So the Caregiver Help Desk, while not a crisis line, is a great resource to kind of reach out to if you're, kind of struggling to figure out, what do I do?
Okay, very good. Thank you, Nicole. So I'm going to just ask, we're going to do a wrap up here. We don't have any questions from the audience. So I'm going to ask each of you just share a resource or one past piece of advice, or last thing that you want to comment on. So I'll start with Ivana. One last piece of advice or a resource that you'd like to share.
Sure. One resource that was really helpful to me is leaning into, if you're someone who's spiritually involved or part of a religion, they're wonderful sources for support for everything you can think of from the emotional side, but also the support groups and resources for other centers that might be able to have other support for you. So I would throw that out. If it's not top of mind, even if you're not involved, they'll work with you if you're even not part of that community usually.
That's great advice. Thank you, Ivana. Bailey?
Yes, my advice to caregivers is always to keep that line of communication open with your providers. Whatever question you have, large or small, is never too unimportant to be asked. Also, with the advent of telehealth being more predominant because of COVID, I really believe that should be leveraged. Have the video visits if it's too inconvenient to go into the office. Have those video visits with your physicians, with your nurses, or with your pharmacists to really leverage that face-to-face interaction as well. And I know that our audience is probably all over the world. I only know of resources in the Bay Area specifically, such as Institute of Aging, Community Living Fund. There's also the Friendship Helpline through the Institute of Aging. So if there's any lonely seniors out there, there is a 24/7 hotline, 7 days a week, for those seniors to use whenever they feel lonely, because loneliness does hurt health as well too. And that's my advice.
Thank you, Bailey. Wonderful advice. And Nicole?
My advice is, while it's very easy as family caregivers to put our own health partner, that can have really detrimental effects. So when it comes to, well, I can put off this doctor's appointment, I need to take my loved one to theirs. Try to find ways to make both manageable, because you have to be able to be there and healthy for your loved one to. And so there's a lot of tools on our website in terms of talking to your doctor, your loved one's doctor. Just never neglect your own health, because that can have some pretty bad impacts, and it's really important and something that's really easy to push to the side.
Great advice, Nicole. I thank you, Nicole, Bailey, Ivana, for your great perspective and advice. This has been a fantastic event, and everyone watching, thank you for joining us. We'll post all the resources mentioned during this call on both Facebook, LinkedIn, and under the event announcement. We'll also be posting a recording of the call on our YouTube channel, again, with the resources noted there. Our next event is on March 22nd. It's Autism Service Dog. So if you want to see some furry friends that are helping some young people with autism, please join us on March 22nd. You can find the event listed on our Facebook and LinkedIn pages. Thank you, everyone. Have a good night.
Thank you, everybody.